Hi, my name's LBaker. Today I'm going to be discussing how mentoring in nursing can improve nurse retention and hopefully help the nursing shortage that our country has been facing for a long time. This was a Capstone research project for my BSN. The title of the presentation is Mentoring Nurses, a Retention Initiative. Approximately 17.5% of newly licensed RNs will leave their nursing job in the first year, with 33.5% leaving in the first 2 years. These numbers are pretty astounding to me within the first 2 years that many nurses are leaving the profession. The nursing shortage has been an issue for a long time nationwide. The nurse turnover occurs for many reasons. People may leave for personal reasons, organizational factors that don't mesh with their personalities, work environment, that kind of thing. I mean, anything. Disruptive, it can be very expensive, disruptive, and it threatens patient safety and patient care. Implementing a mentorship program in nursing helps to retain highly educated, qualified, and skilled nurses in the profession to deliver the safe and quality care that patients deserve. There are many benefits for both the mentor and the mentee in this situation. There's an improved sense of belonging as a nurse, an increase in job satisfaction, and it helps to decrease stress and anxiety associated with the new role. All right, the next couple slides are going to be discussing the literature review that I did before the presentation, okay? 5 studies will be discussed that kind of evaluate and discuss how mentorship programs have been implemented in other places. So this first one was done to assess the likelihood of and reasoning for nurse retention. There were 97 hospitals in 3 different states that participated. 42 of the hospitals implemented the transition program. The 1-year retention rate for all the newly licensed nurses was 83%. Larger hospitals had lower retention rates, which I thought was kind of surprising. BSN prepared nurses were more likely to stay than were ASN nurses. Urban hospitals had the highest rate of retention at 85%, while magnet designated hospitals had a retention rate of 89 to 94%. This study shows that a transition, residency, and mentorship program can improve nurse retention depending on facility qualities or certifications, I guess. Let's see. The next study was done to create a program to standardize the orientation process, just make it all universal within the organization. A 561 acute care suburban hospital in Arizona participated, specifically a 30-bed med-surg unit with 39 new graduate nurses. There was a 5-week new employee training unit program, or a NETU program, utilized with designated preceptors. There were supplemental learning experiences and a competency tool used as well. The measurement of success of the program was, of course, an improved retention rate with these nurses. As a result of this 5-week program, 100% of the 39 new nurses that completed the program were retained. This program, following this initial program, was implemented in the rest of the hospital due to its great success. Obviously, this study shows that establishing a mentorship program, or learning program in this case, for new graduate nurses does improve their retention rate. All right. The next study was done to determine what effect that a mentorship program has on nurses and to determine if their retention rate improved following the implementation of the program. This one, a little bit closer to home, 325-bed community hospital in northern Indiana was the setting for the study. 70 newly hired nurses, they were unclear if it was new grads or if they were just new to the facility, were divided into 2 groups, one that was mentored, one that was not, with 32 mentors paired with half of those nurses. The retention rate was compared to 6 months prior to the implementation of the program and 6 months after. 91% of the nurses in the mentored group were retained, while only 66% of nurses who were not mentored remained with the facility. Obviously, these study results show that a retention rate will increase with nurses that are mentored versus those who are not. And in this study particularly, there was a survey after the fact that showed what benefits both the mentors and the mentees received, personal benefits. All right, this one's got a lot of information on it. But this one more or less just discusses what a residency or mentorship program would do and the effect it would have on the nurses. So the new nurses would spend time in the clinical setting learning from, whether it's a experienced nurse or it's just a fellow coworker in the clinical setting. This allows the new nurses to apply what they have learned in school, and while also modifying a little bit of their skills, their communication, their organizational skills, and learning policy and procedures of the hospital that they're working at or the facility. They're able to increase their confidence and learn how to manage a team of patients prior to more or less being thrown to the wolves. And they do get a improved sense of belonging. They increase their competency in their skills, and they feel a little bit more secure with the way that they practice nursing. One example that was listed in this study was in Maryland. After the implementation of a nurse residency program, the state itself saw a retention rate increase from 91% in 2014 to 96% in 2016. So that's statewide, that's pretty good. All right, let's see here. This next study was done to determine if the participation in a mentorship program had an impact on the transition to practice itself, as well as the retention rate for new graduate nurses. Again, this one was done in a small community hospital in northern Indiana. There were 14 new graduate nurses hired in the last 6 months, and this study took 6 months to evaluate. The mentorship program paired a new graduate nurse with another more experienced nurse to mentor them in the transition from student to competent nurse. Retention rates were compared to the previous year for the number of nurses that were hired to see if they were retained after being mentored. Educational assistance was provided through this program, and again they were able to learn the organizational policies, procedures, how to work in a new facility while reinforcing their nursing skills they learned in school. Following the implementation of the program, 9 of the 14 nurses still remained employed by the facility. This study does show that mentorship programs improve nurse retention, and that they assist with the transition from student to nurse, along with the resources and support they need to make that stressful adjustment. Okay, let's see here. The PICO question, which it frames research. The PICO question for this issue was, would establishing mentorship programs amongst nurses increase nurse retention when compared to the retention rate of nurses who were not mentored? So the population directly affected is nurses. The intervention that would be proposed to address the issue of nurse retention and nursing shortage would be to establish a nurse mentorship program. It'll be compared to the opposite of what it would be is not receiving any mentorship. Of course, the outcome is to increase nurse retention. And every research study has theoretical framework that supports it. This one in particular, Hildegard Paplau's theory of interpersonal relations in nursing, directly relates to this issue. This theory addresses the importance of the nurse-patient relationship in the healthcare setting. As we all know, time is of the essence, and in order to develop these relationships between nurses and patients, there has to be a little bit of time involved. Lack of time due to being understaffed or managing too large of a workload can not only be overwhelming and stressful, but it does not allow those relationships to develop. I know we hear now, it's not what you do for people, it's how you make them feel. So this directly relates to that. In her theory, Paplau describes 6 roles that a nurse incorporates into their patient care. Depending on the needs, of course. It can be a counselor, a resource, a teacher, technical expert, a surrogate, and a leader. If nurses were to have adequate time with their patients, they are able to establish, maintain, and improve the therapeutic relationships they have with their patients. Mentorship programs directly relate to this and play a role in establishing interpersonal relationships between nurses. They're able to share knowledge and skills with amongst each other and encourage them to pursue excellence in every aspect of their career. When nurse retention improves, this is the time where the nurse-patient relationship can improve as well and is able to reach that therapeutic level that helps both the nurse and the patient. All right, so I had to come up with a prospective study that would implement a mentorship program. So the next couple slides are going to discuss how I did that, or how it would be done. So a quantitative and qualitative experimental study would have been done with a post-test only design. So there would be numerical results and there would be a narrative result as well. The setting would be a mid-sized regional hospital in southern Indiana. The study would be a 1-year mentorship program to determine if mentoring improves the retention rate of nurses. The sample ideally would be 30 nurses, but you would use however many newly hired nurses you have within a year's time, preferably split into two equal groups. Each newly hired nurse would be paired with another nurse that is currently employed by the hospital, and the study participants would be selected using a consecutive sampling method, which means if you were hired, you were participating. The two groups would be, one would be an experimental group, the other would be a control group. The experimental group would receive the mentoring. The control group would not. Each nurse had the equal likelihood to be assigned to either of the groups. A self-report questionnaire and evaluative surveys would be provided to all participants that were completing the study. That's where that qualitative results would come from. The retention rates before and after the implementation of the program would be where the quantitative results would come from. Of course, privacy, rights and confidentiality are at the forefront of nursing, so an informed consent would be signed ahead of time, letting them know, all participants know how they would be affected and what possible benefits they could receive. The only information that would be included and distributed to participants in the program would be age, the years they have experience in nursing, what degree they have, if they were male or female, and if they had a specialty that they were focusing on or currently practicing in. The information provided in the questionnaires would not be disclosed to the public, again, to protect privacy in case there were any good or bad results. All right. Demographic information would have been collected ahead of time using a background information survey. Again, asking about any history of mentorship, their goals for this, if they have any qualities that would lead to success in mentoring. The nurse retention rates would actually be obtained by contacting HR, looking ahead of time at previous years on, hey, this is how many we retained, this is how many we lost, to determine if after the fact of the program was completed, if it was successful or not. So HR would be contacted before and after completion of the program. There would also be participant satisfaction surveys given to all participants at the end of the study. They would be two separate ones, one that was completed by the mentor, one that was completed by the mentee, to see what or how satisfied they were with the program itself. All of the surveys that we would be using in this study would be was developed by the Academy of Medical Surgical Nurses. And let's see here. The quantitative results, so the nurse retention rate would be analyzed using a chi-square test to see if the retention rate of nurses who was mentored was higher than that who was not. All right. So in conclusion, the turnover in nursing is contributing to the nursing shortage. We hear every day we don't have enough nurses to staff some facilities. Implementing a mentorship program is one intervention that can address both issues. Obviously, there are a lot of interventions that people can do to help with this issue, but the overall benefits of mentorship programs for the patients and both experienced and new nurses are overwhelming. Let's see here, of course we want to focus on patient care as well, so if we retain the highly qualified, skilled, educated nurses, that will improve. There are many benefits, as I discussed, to all the nurses. They include, but are not limited to, an increase in job satisfaction, work